So forearms on the floor, fingers facing the hips, just letting the ribs drop. Right, so I'm in a little bit of a flexion shape, right? A little bit of a rounded shape. Spine just hanging towards the floor. And I'm just gonna play with rolling towards an arch. So rolling down the length of the sacrum, right? Almost pushing my sitting bones towards the floor. And then roll up the length of the sacrum, posterior tilt. And even drop the ribs back even more towards the floor. And then roll down the length of the sacrum towards sitting bones, towards tailbone. And then this time as I rock back, I'm gonna pick my feet up, right? So as the top of the sacrum touches the floor, lift the knees up and continue curling the tailbone up towards the backs of the knees. And then as I roll down the length towards the tailbone, I'm gonna let the feet come back down. One more, rolling, posterior tilt, rolling up the length of the sacrum. Once the top of the sacrum comes closer to the floor, pick the knees up. And then as you roll back or down towards the tailbone, plant the feet last time, lay the sacrum back, lift the tailbone, lift the knees, and then roll the weight back. Okay, coming onto your back. All right, so I'm gonna do figure four. So I'm gonna take that right ankle onto the left knee. And similar, right? So I'm gonna roll down the length of the sacrum towards the tailbone. So I'm trying to press my sitting bones into the floor. Right, and you'll feel just a little bit of a stretch in that kind of outer back of right hip. And that as I roll up the length of the sacrum again, I'm gonna pull that left knee in towards my chest. And I'm not gonna use my hands, I'm gonna use my left leg. But keep curling the tailbone towards the back of that left knee. And then slowly roll down the length of the sacrum. And you can even keep that left knee pulled towards the chest as you roll the length of the sacrum back down. So you're pulling the tailbone towards the floor, just giving a little extra stretch on that outer or different stretch. And then left foot to the floor. One more time, a little bit of an anterior tilt. Lower back comes off the floor. And then as you roll up the length of the sacrum, pick that left knee up. Let the left leg draw that right leg closer. Good, and then keep the leg here. Start to roll the sacrum back down, sitting bones back down. Good, and then slowly lower the left foot. One more time, right, again, anterior. As you roll the sacrum, top of the sacrum towards the floor, the knee picks up. So the back is rounded. I'm in a tuck position, left knee comes closer, and then maybe I even straighten that left leg for a moment. Maybe grab the calf, maybe. And then again, keep the leg where it is and start to roll the sitting bones down towards the floor, just getting that slightly different stretch in the right hip. And then left foot comes back to the floor. Good, right foot to the floor. Let's do the other side. So left ankle on the right knee, again rolling. So I'm on more of the center of the back of the pelvis and I'm just rolling towards the sitting bone, right? Like I could push my butt back into the floor, lower back lifts. And then the opposite, right? A little bit more of a tuck, top of the sacrum and the waist get heavy and the right knee lifts up. Use the right knee to pull that left leg closer to you. And then keep the leg where it is as you start to roll the sitting bones back towards the floor. Right? You're just creating almost a dynamic or a tensile load through the tissue. And then lay that right foot back down. Follow it into an anterior tilt, posterior tilt. Right knee comes up as the tailbone lifts. Pull the knee closer to the chest without the hands. And then keep the legs close to the chest, start to roll the sacrum back down. Roll towards the tailbone. You might not get as far as you want, but then let that pull that right foot down. And again, a little posterior tilt. As the waist gets heavy and tailbone gets light, the right knee lifts. Maybe the right leg straightens this time. Maybe grab your pants or your calf. Again, I'm in a more of a posterior tilt, and then I'm just going to try to pull the sitting bones back down. Good, keep pulling the sitting bones down, and then eventually release that right leg. Right, just changes how you're engaging the tissue. Good, left foot on the floor.